Good day, citizens of the world. Welcome to the Heart of Go Natural as you embark on your journey to divine health. So this year is my 19th year of recovery from advanced multiple sclerosis, and I've discovered a lot of information. And one of the things that I'm going to share that's also well documented in my book of discoveries. This is my book of discoveries. The last 19 years I've recovered, and so one of the key things that we discussed in the previous video is that why are we the only mammal to brush our teeth and yet to develop tooth decay? And ultimately the tooth decay just becoming bigger and bigger and bigger. Why does it become bigger? So your fillings become bigger slowly because we continuously being malnourished. So tooth decay, as explained in that previous movie, is that tooth decay is a symptom of being malnourished. Instead of being up pure nutrients to the original food chain, we keep on with this highly processed and refined food chain. And that will render your teeth softer and softer. You'll become pre-osteoporosis, you'll become blown up, and you'll become high blood sugar, ultimately obese, and then diabetes. And that is the progression, basically. But here in the mouth, the progression is your fillings become bigger and bigger and bigger, because fillings, is a different material as your tooth structure. So every time you drink something cold, the tooth shrink and then it expand. And the expansion ratio of the tooth structure and the filling structure is two different things. Ultimately, they develop micro cracks, and then liquid and food and something goes in between, and it's a perfect place for bacteria to harbor, especially anaerobic bacteria. And then the filling becomes bigger, and by the time you've got pain, a lot of tooth structure has been lost. And then, so the fillings grow, ultimately. And when the fillings has grown, the pain is ultimately, when that leak is again, then the pain is going to become unbearable and no filling will work anymore. And the doctor will tell you, listen, you need a root canal. Now, a root canal is a procedure where they remove, a tooth consists of many parts, but the outer part is the enamel, and inside there's a root canal where a blood vein is coming up, the artery and the vein up and down, and there's blood pressure. And if that artery is fortified with good nutrients, you can have that tooth for life without fillings. But if not, and then it's a substandard immune system that enter the tooth root, and then the fillings become bigger and bigger and bigger, and ultimately you need a root canal. And now the root canal involves that you're going to remove the blood supply and the nerve supply. So when you do that, it's a procedure where they have a flexible drill all the way down to the apex of the tooth. That involves that the tooth is actually dead. So that tooth becomes the tooth a dead bone after you remove the blood supply and the nerve. Now, when there's no blood supply, there's no white blood cells, there's no immune system, and it becomes a infection. All root canals is basically infections. So, and you'll see somebody will smile and they've got a dark tooth, and it means that underneath that white enamel ivory type of material over the tooth is pitch black inside of it. So so that renders that dead bone infection, and it becomes so aggressive, and ultimately there's abscess underneath it. And it actually breaks your immune system. It's just way too much for your immune system to cope with. So I would strongly recommend that you never go for a root canal procedure. And if you've got root canal procedure, in my book, there's methods how to remove it. Because the whole jawbone, the adjacent jawbone around that tooth is being infected with this anaerobic bacteria, which is very aggressive. So this book has been written in the early 1900s to help us not to take root canal and to warn the medical system not to go for this procedure, but they actually went for it. And for me, it's one of the biggest risk factors to have in your body. To having an infection, a dead bone in your body does not make sense in any case. So then that is the number one dental pathology, is root canal. The other one is when you extract a tooth and the periodontal ligament remains in your jawbone. Then before that jawbone, the gum line grow over the pocket where the tooth has been extracted, bacteria goes underneath there and it starts to mutate. Bacteria can mutate. It means it changes from function and form. And so I had 3 of those cavitations here in my jawbone, where 2 wisdoms has been removed and 1 root canal has been removed. And when Dr. Huggins and his people removed it, they said, we've hit a Grand Canyon here, and the revolting smell that came out of my jawbone, all 3 of them were severely infected sites. So jawbone cavities and root canals are the elephant in the room in medical industry. They don't recognize it as a severe infection. It's a severe infection and it can break your immune system. And you'll see in this book, Cancer Cured, The Coming Storm, Am I Dead or Do I Feel Like It? The author is Dr. Fred Hughes, and if I go to one of his pages, and where he tell people, because you know what, he helped 1,000 breast cancer patients, and all the 1,000 breast cancer patients had the same problem. Look what he's saying. Watch out for those root canals. So this is the thermal image, and she's looking at us, and you'll see the root canal site is red there because it's hot. And under the arm, the lymphatic node is also hot, and there's a breast cancer on the right breast. So what he's saying here is the thermal scan shows oral pathology on the right side of the mouth and a tumor on the right breast. If you have a root canal on one side of your mouth, you better start watching that side of your body. It never crosses, says Dr. Robert Dowling. So yeah, okay, so unfortunately, the Sea of Deception, they legalized having infections in your mouth. And if you want to live in wisdom, you remove those infections. My book will help you and show you how to do it. There's a need for biological dentistry, people that will not put a dead bone in your body. That is what we need. So we need a change. And I hope you can enjoy this book, because this book will help you to understand the dangers of dental pathology. And you know what, I've got so many books that I refer to this topic of dental pathology, because this is arguably one of the most dangerous things that you can have in your body is dental pathology. Yeah, be safe, live in wisdom, and I hope to see you at the next video. Thank you, and God bless. Till the next time. Bye-bye.